I'm Dawn Snow. I'm a family practice physician at Southeast OMC. So I enjoy seeing babies all the way to the very elderly. I have 10 years of OB practice, so I am used to taking care of very tiny babies. In the past, as I said, I did OB, so I have done a lot of women's medicine. I come from a practice where I was the only female with 7 men for 10 years. So I really enjoy women's medicine and children's medicine. I enjoy the whole scope of care, once again, from the very young to the very old. I was debating what I should be. I really thought about being an OB doctor, but I was standing in line at Sam's Club one day and this older guy just kept razzing me, and I thought, you know what, I can't give up taking care of these guys too, and so it was a good decision. I think being part of their family, and unfortunately I feel like practice is getting away from that some, and I loved in my practices where I was there for 10 years seeing the grandmas, the moms, the dads, the babies, and so I would learn so much about the families that I would know what medicines worked for who. I would know how people were going and doing just by the way they looked on their faces and how mom was doing and how I needed to treat daughter. It's really important instead of such piecemealing these days. Well, overall, I really care for my patients. I mean, no matter who they are, what their background is, I really want to see what I can do to help them. And if I'm not communicating to them what their need is, I really keep asking, is that what you're looking for? Do you feel comfortable with that decision? Am I helping you with your fear? Try to meeting them halfway, and I hope that they do speak up if I haven't met what they came to see me for, because everybody has expectations, but sometimes physicians have an agenda, patients have an agenda, and it's so important to meet halfway. I do some dermatology procedures. Sometimes it takes a while to get in to see a dermatologist, so I do lesion removal and things like that, and warts and little here and there. So I'm from South Dakota, have been here for about 1.5 years, and my husband and I, we enjoy pheasant hunting together because we were up from northeast South Dakota in the Aberdeen area, and we enjoy being out by the lake. We have a garden that we enjoy with flowers. My husband's a pilot. He's a helicopter pilot, works as a medevac pilot. So he's in healthcare. He was in the National Guard for over 30 years. Oh, I have been to some clinics that just isn't a joy anymore. And with COVID, it sucked the life out of medicine. And so you kind of have to reframe now coming to work. And here, since I've started here, just even coming to the front desk and smiles and the community here at OMC, it's so much more family-based. And the physicians and the providers, it's easy to talk to people. The patients are able to get hold of their physicians much easier. There's not so many steps for them to get through, and it's such a great place to work.